Are you able to see that, everyone? Great. All right. Whenever you're ready.
So I'm not really sure what to do because we've never done this before, but
We'll do it together. Sorry.
I have a young lady that I've been working with. Since I submitted this, she just had her 8th birthday.
Oh.
She lives with her mom. There is a history of trauma with her. The big issue with her right now is that she continues to state that her brain is telling her to do the things that she's doing and saying to her mother, and that it's something like it's not her inner voice, it's like someone else in her head telling her to act the way she is, and she can't control it. She has a history of a lot of behaviors. She's physically aggressive, she's verbally aggressive, she's self-injurious. She does have a diagnosis of autism and anxiety. She has seen numerous counselors, psychiatrists. They've tried numerous psychotropic medications. Nothing has touched what she calls her brain talking to her. That's the best way that she can articulate it. And really, I'm just kind of at a loss of what to try to help mom to do, because with PBS, we can only do so much to address the behavior when it's obvious there's more going on than just behavior with her. And she's had numerous inpatient psychiatric hospitalizations. They never really get her stable. They get the behaviors down to a manageable level, and that's it. And she has gained a very significant amount of weight with them going through all of the psychotropic medications, trying to find something to work. She is almost 200 pounds at 8 years old, and I am worried about her health and what's going to happen with mom when mom can no longer handle her just because of her size. And so anything anyone has to offer of where I can connect mom, things that we can try, I am all for it, because this is one I'm really not sure where to go with.
Thank you so much. That is definitely very difficult, I think, for anyone to hear of a child having such difficulty, and for the mother. So I definitely feel for that situation. Does anybody have any comments, suggestions that we can give Cheryl?
Hey, Cheryl, I just have a couple of questions as we try to kind of figure this out. Is there been any sort of patterns or understanding of sort of that ABC, kind of the behavioral mapping, if there's been any sort of like clear antecedents or kind of outcomes of the aggression and some of the big events? Do we have like kind of more data about like how often those are happening, if they're predictable, or some of like that behavioral stuff around it? Has anybody really looked at that pattern, or are they predictable? Do you know?
Some of it's predictable. She's more likely to become physically or verbally aggressive if she's being denied access to a preferred item or activity. But sometimes and I don't really know how to describe it, but sometimes you can be looking at her and talking to her, and then like this other look will come over her face, and the next thing you know, she's telling mom to go F herself, I hate you. Mm. And then like 5 minutes later, she can be fine again. And it's just really odd.
Is mom usually the target of the aggression, or does it kind of go to other people?
It's almost always mom, and sometimes other children at school, but she's doing virtual school right now. So of course, everything with school's no longer an issue, but now it's mom because she's with mom pretty much 24/7. Mom's not been working since COVID started. Mom's not been able to take her to daycare because it closed. She does interact with grandma some. Grandma has internet at her house and she's been going there to do her schoolwork, but her attitude towards grandma is completely different than her attitude towards mom. And I think it's just because, as they say, familiarity breeds contempt. And I know I'm less than thrilled with my own children sometimes because we just see each other all the time.
Do you have any information on how school was going before the whole virtual thing? Were there similar problems, or was this just, did this sort of
No,
change it?
there were similar problems at school when she was in school. I've been working off and on with them for a while between COVID and her hospitalizations. Like, we've not got to where we could finish anything yet, but at one point she got removed from her
Primary school and was sent to another school in the area, I think for about 8 weeks, that she went there primarily to address her behaviors because she was getting sent home, having mom have to come pick her up because she was being aggressive towards peers and I think a teacher a few times as well.
Can you talk to us a little bit about her autism diagnosis? What are some of her functional deficits?
She does not do well in social situations. She's very easily overstimulated, light, noise. Her anxiety is really her bigger issue than the autism. And the anxiety has gotten worse since their home was broken into. They've since moved from that home. They weren't home when it happened, but they came home to the door kicked in and all of their stuff tore up. And since then, she doesn't want mom out of her sight. She wants every light in the house on all the time, regardless of what time of day it is. Mom has told me that some nights she won't even sleep in bed.
Was
Thank you
the
so much
was the
for those great questions.
was the diagnosis of autism like well before the big escalations in some of this, or has it kind of all like come out at the same time? Do you kind of know?
She was diagnosed with the autism before all of this, but really it goes back and forth depending on which counselor or psychiatrist she's seen, where they stand with her diagnosis. Because even from when I first met her to now, like, there's been a pretty significant improvement with her ability to interact with people. When I first met her, she wouldn't speak to anyone except through mom. She would tell mom what she wanted to say, and that was the only way she would talk. But that has gotten a lot better, which is why when she told me point blank, you know, my brain's telling me to do this, that I'm like, well, something's going on. Like, if she can actually articulate this to me, there's something there.
Mm-hmm. Do you know if she had a full psychological evaluation, autism assessment?
I don't think she's had any recent psychological assessments. I think the ones that she had are several years old at this point. I think she was diagnosed when she was 3 or 4, and I think that's the most recent full psychological that they've had.
Has anyone like considered like PTSD or sort of like trauma sort of aspects of this for the patient and the mom? I think too. Just with all the stress and the change and the pandemic, I guess it's just screaming to me like PTSD, like complex sort of things. I wonder what other people have thought about that.
That's kind of been my thought too, because mom shared with me that when the client was a baby, like she had issues with drugs and with dad, and so mom used, dad was abusive, that's why she left. There's the no contact order, and then occasionally he comes back up and thinks, you know, he's going to get custody when he's in and out of rehab, and stalking her, and like there is a lot going on with him. And they're both doing counseling. I think mom finally got back in with a psychiatrist as well, but I don't know if they found anyone specifically to work with them to address all of the trauma. And mom told me the last visit that I had that they do have a counselor that's currently coming into the home to work with them, but her advice when she said that the stuff in her brain is telling her to act that way was to say to herself that it's not real. And that really bothered me because it's real to her. And that's what matters, is that, you know, we accept that, you know, we may not understand this, but it's real to you. So, yeah.
Are they involved in any other services besides PBS?
I don't believe so.
Do you know who's coming into the house? Is that like DHHR, or is that like Safe at Home, or do you know that's not us. That's not PBS coming into the home.
No.
That's somebody else, or
I think it's just whatever counselor they have services with. I think, did she give me? I may have her card that says where she's from.
Because this was a new counselor. They've been through 3 or 4. And I think that's another issue as well, is they just can't find anyone that will give them consistent services because of everything else that's going on in the world.
yeah. Which is probably equally traumatic too, to have to go through all that.
She is with the Mountain Care Network, which I've never heard of before.
I have not either. I'll have to look it up. I'm not sure. Was it for autism, or you don't even know what the?
She is a clinical therapist with the Mountain Care Network.
Do you happen to know what medicine she's on by name? I would assume it's probably an antipsychotic if she's gained all this weight, but do you have
I'm
any
not
idea
sure what she's on at the moment, because it seems like nearly every time I go visit her, they've changed her meds again.
Okay.
I know
So-
she's on something that's an antipsychotic, and I know she's also on something for ADHD. And then I think they're still giving her something to try and get her to sleep at night because she doesn't sleep well.
And is that all sort of that same kind of fear response about like leaving mom and falling asleep and being scared about something happening, or are there other things that kind of go on at night?
That one I'm not entirely sure about, because even when I first met them, mom stated she didn't sleep well at night. And that was before the break-in and everything else.
Do we know any of the potential history with parents, if there's more trauma history for this kiddo than just the recent stuff? If she experienced any DV or any abuse by anybody as she was growing up too?
As far as I know, dad never actually did anything to her. It was all with mom, but it was apparently severe enough with mom that dad was ordered no contact. And
in the time since I've met them, she was sexually abused by someone that mom knew.
So there's
And
a
that's
definite
just
trauma
added to
there.
everything.
Do we know if she witnessed or heard the things happening between parents?
I believe she did witness it, yes.
So I would suspect she definitely can really use a good trauma therapist that would
Yeah.
stick with her long term. What area are they in?
Charleston.
I know there are some really good people down there that I've heard of. I don't know them personally, but I've heard of some really good individuals down there if the family is able to reach out for services, but I don't know what their transportation might look like either. And COVID.
So I just looked into that Mountain Care Network. It's just a private mental health agency that does in-home and out-of-home, but they list that they can do TF-CBT. They're all licensed clinical social workers. So that might be the easiest way to get them the services that they need is through like an agency they're already established with. Although you seem to have some concerns about the treatment that she's receiving.
Well, and the other sort of layer to this sort of that my brain is sort of thinking about sort of developmentally is, you have the autism piece or concern about developmental delay that was there maybe from birth and communication issues and social issues that were present, maybe even in utero exposure. So this kid was sort of born with probably communication challenges for a variety of reasons. And we forget, I think, as adults, how much trauma can like impact kids that can't verbalize, right? So I mean, it really does kind of like rewire your entire brain, and your body becomes so reactionary that now that she's putting it into words, my brain's telling me to do that is probably actually very accurate in how she understands it. That's sort of that self-talk component. Kids kind of try to make sense of things and sort of assign cause and blame, but all of that trauma and all the aspects of change, she was experiencing that, and her physiology was changed even before she could verbalize it. And I even the family dynamic part of hearing how mom is almost kind of becoming afraid or scared about her weight and the size, I just sounds like as she revs up, it triggers mom's trauma, I would think too. So not just trauma care, but like family-based trauma care is sort of what's really kind of exploding in my head right now in terms of how critical it is, and just the education behind all of this, because it sounds like people have attributed her behaviors to like so many other things. Like on one hand it's like, oh, just tell yourself that it's not real. On the other hand, it's anxiety. On the other hand, it's autism or it's ADHD. I don't know that any of those, I don't know if those things are accurate with that level of how much trauma they've had. And so I just even like wonder the extent of where they are. Has anyone ever talked about how trauma impacts families or kids with development? I mean, there's, and that discussion about how much trauma could be an explanation for so many. This can be so reassuring to kids and parents. There's not something wrong with me. My brain was created this way, but if I understand it, it can be fixed, and we can kind of build back safety, because safety is like such a theme, right? Like, lashing out and you don't get your way at night, when people leave, the trauma of someone breaking your house. I mean, it just sounds like this kid lives in this kind of hyper vigilant state of fear. And when she like reaches for even that idea of, well, you're not getting your way, you lash out, but that's also very much like not just getting your way, but like, are you getting your basic needs met for like reassurance, and you want something and you need something that's meeting a basic need and you don't get it? Of course people get dysregulated. And how can we kind of reframe that a little bit, I guess, to make it not like she's acting bad on purpose, or I don't know. It feels like there's conceptually a very different thing going on than all the labels we've given. I don't know what other people think about that, but it just, as I said, even as you presented, I could just hear the trauma, and it was such a different, you presented it in that way that I just, how could people miss that? I guess.
That's what I wonder, like, they've seen all of these specialists, all these counselors, all these psychiatrists, and all that they get is, you know, another label added, another prescription added. And I'm like, do y'all not realize everything this family has been through? Can we not talk about that some and look at how we can address the actual root of some of these issues? And I've asked Mom, I'm like, you know, has anyone ever talked to you about addressing any of this? And she's like, no, they're just worried about her behavior. And I'm like, well, a lot of the behavior is stemming from all of that stuff they're not wanting to talk about.
So I'm sorry to kind of shift subjects, but I wanted to let you know I put in the chat 2 possible resources that might make Mom feel a little bit better. There's the state now has a child crisis and referral line available 24 hours a day. Oh, thank you, Mitra. And then the other is a link to a really short PDF or PowerPoint, sorry, about this new mobile crisis response team, which is slowly rolling out through the whole state. It looks like, did you say Charleston? Charleston has one through Prestera. And so they can get a mobile crisis response team to the family within an hour. And that would be like alternative to having to call police. So in my mind, if things continue to escalate and Mom's really fearful, maybe she'd feel a little better knowing that there are some like immediate supports for her. And the goal with all those services is to keep a kid out of the hospital if possible, keep them out of like legal trouble if possible. It doesn't really necessarily help her mental health issues, but may make Mom feel a little safer or supported at least.
Absolutely. Thank you so much. We will make sure that we have that in the recap email. And I do apologize that I didn't get to have Nick or Katina introduce themselves real quick as we continue this conversation. Katina, can you go first, please?
Yes, my name is Katina Westball. I'm a master's in social work intern underneath Charity Heading through Concord University.
Great, thank you. Nick?
Hi, everyone. Sorry I was a little late with a client meeting, but I'm another one of the PBS program staff.
No worries. Thank you so much. And thank you everyone who's chatting in. I really do appreciate that. A lot of suggestions and very good presentation in case we have more time, of course, so please do continue having them come in and discuss further. And yeah, Cheryl, you're doing a great job. So thank you so much for the case, and hopefully that encourages others and yourself to continue to do that.
I have another one too, so maybe we can do that one next time.
Yeah, absolutely. Yeah, you do. You just like, you can feel the, you know, you're really good at just like bringing that realism and connection while you're doing, so it doesn't feel so structured. So I do appreciate that. But, you know, if anybody else has suggestions or questions and want to continue, go ahead.
And I think Colleen was kind of asking a lot about the autism diagnosis. I'm very curious about that too. But I mean, again, kind of like the descriptions that you gave about her ability to verbalize and communicate and talk more with you. If autism is becoming the focus of things, that seems kind of not the place to put my energy right now. Clearly, she definitely has some skills, and I think sometimes people think like, if you know, kids with autism who have communication delays or any developmental delay are actually going to be more at risk to have PTSD, and it present kind of with the complicated behavior piece. And I guess I'm not even sure, part of me like wonders how accurate that diagnosis even is. If that's kind of distracted people, that would be something I'd be really interested in. It may be distracting from the medication perspective too, if that's, you know, it's very hard to separate out severe anxiety and kind of avoidance withdrawal behaviors from what looks like autism. And it really is what you said, as you get to know someone and you kind of decrease the anxiety because of familiarity, only then can people kind of really show you if they can communicate and demonstrate those things. And if you just look at it at first glance, it can absolutely look the same. And it really seems important to kind of really tweak that out because some of the treatment paths are so different. So I guess that's something I would really want more information about. And the other thing is ADHD too, right? I mean, that hyperactivity it's common in autism, it's common in kids, but it's also like hypervigilance, right? PTSD, I can't sit still, I got to move to stay safe, or, you know, sitting still with my feelings is so overwhelming. And from a medicine standpoint, so I'm very curious what the medicines are, but if you really would use stimulant medication for ADHD and it's hypervigilance, not going to help and probably going to kind of make it worse. There's sort of studies that show if they really don't have ADHD, if you give stimulants, they did this with like adults, not kids, but they gave like wartime people in active military stimulants to improve their focus and actually increase their rates of PTSD because they kind of supercharge their reaction systems. And so, you know, you worry about maybe stimulants in kids if that's wrong. Now, other ADHD medicines like the blood pressure medicines, those alpha agonists that we talked about in some of our med meetings like clonidine and Intuniv, those might have much more benefit for hyperarousal symptoms without sort of that risk. And as I said, the antipsychotic's interesting, but you know, did she even have an anxiety? You know, didn't even try actually anxiety medicines, like true anxiety medicines with real trauma therapy, because you're really looking at like, if you're really going that PTSD like route with some of this, you know, really thinking like family-based, trauma-focused kind of treatment for mom, kid, family, education, and then like meds that kind of like match that, which are maybe more likely to be like SSRIs and those alpha agonist blood pressure medicines, like in terms of kind of more like standard sort of approach. But all of that comes back to how do you really assess the problem and what's really, really driving it. And also, we also know that all that early trauma can really impact IQ. And so I think Colleen's point about like testing, like, do we know where she's processing information and where, you know, because you want to deliver the information on her level. And so, you know, is she normal IQ? Is she at a lower level? Are there other learning issues that are going on? Like, I think having like really up-to-date testing of the cognition piece, which sometimes the school can do. As I said, she may not be able to do more of the sophisticated stuff if she's that anxious, but even just getting basic kind of measures of her IQ and how she's learning could be a better place to kind of meet it too. But as I said, you know, that's such a hard thing to tease out, and a lot of kids get labeled with all of those things when it is trauma. And so it kind of feels like, let's go back to the drawing board a little bit. I don't know.
That's kind of how I feel with her. Like, the more I get to know her and the more that I see her, I really start to wonder, like, are all of these things they've diagnosed her with legitimate? Or is it all just a manifestation from all of the trauma that she's lived through? And I feel like that too many people are getting stuck on those labels because it's handy and convenient, and we're not looking at where we really need to be looking to really help her.
The other thought I had was, how do her and mom, like around you, how is the interaction between her and mom?
It depends on the day. Sometimes her and mom interact really well. Sometimes it'll be okay the first few minutes I'm there, and then she'll start with the back talk and starting to throw tantrums because mom's not letting her have her way. Thankfully, here recently, it's not been anything as extreme as when I first started working with them. But when I first started working with them, she had a complete, like, full-blown meltdown, beating up mom, like just rage-filled, and mom ended up having to put her in inpatient then. Like, thankfully, it's not been anywhere near that extreme in a while now, and there doesn't seem to be a whole lot of rhyme or reason to it. Sometimes her and mom will be laughing and talking, and then, like I said, sometimes it's just like that look comes over her face, and then, you know, I hate you, I want you to die, you're so mean to me, you don't love me.
I know this is a hard one to assess, and maybe Dr. Schweiger has some thoughts, but what first comes to my mind when I hear that stuff is I'm wondering if she's dissociating in session. or dissociating with mom, and what she's saying to mom isn't really meant for mom. She's back there in some horrific trauma experience, re-experiencing it in some way. I'm also wondering if all of this is leading more towards a negative relationship with mom, because mom is now sole caregiver all the time. She's frustrated, she's scared, mom's having possibly her own trauma reactions. And I even just wonder the like child-directed part of PCIT and just like helping them get that positive relationship back. Those like 5 minutes of undivided attention and play. And I think that Mountain Network also says they have people trained in PCIT. I don't know about the discipline side and whether that's appropriate given mom's history and everything at this point, but at least building that more positive relationship between the two of them.
Oh yeah, I totally agree. And also, even though I think dad was sort of the biggest offender too, mom may, there may be some guilt mom's struggling with about her engagement with the kid that might need kind of addressed, and making sure mom has a safe place to talk about it. Because the other thing I worry about a little bit is like some attachment, like again, maybe dissociation, but also like, is the kid still scared of mom? Not in a way that's going to physically hurt her, but like there's sort of like relational repairs to be done. Like, it was somebody that mom knew that sexually assaulted her, and mom may have had some periods with kind of neglect that she didn't meet the kid's needs for her own struggles. And how can you heal that? And how can you make it something that you can talk about? And how can mom sort of kind of get forgiveness too, but kind of have that conversation with an 8-year-old in a way that reassures them that they validate the feeling was there, and that there may be some distress, because some of that back and forth, may also be, this idea, do I really still trust mom, or am I getting safety cues around mom even? That's really, again, until you kind of get it out and kind of talk about it and do that education, it's really hard to tease that out. But that may be kind of at play with some of that as well. I'm not sure. It sounds like there's a lot of not talking about it, that damping it down, making it go away, that's been kind of going on, that isn't making it better. And how can we kind of bring that out and kind of work through it together and get there? I don't know. That's a really hard thing to negotiate. The parents carrying around some feeling of guilt and may have contributed inadvertently to that. And how do you kind of, so yeah, even just working on their relationship, having some fun times together, building that trust between the two of them again is just going to really be the foundation of so much.
Thank you so much. And Anastasia, I see your question. I wonder how she would do in a trauma-informed play therapy. I was wondering if you could expand upon that.
I was just wondering for play therapy in general, since she's so young. But I guess like just sort of play off of the PCIT as well with the parent interactions. Maybe having to that like list of all the good things that she did for the day. Just sort of thinking out loud.
Yeah, really looking for the positive and trying to find that strength-based approach, because there's so much hopelessness it seems like they're feeling in it right now. And how do we kind of get it to, yeah, there's treatment for this, we need to look at this differently and get back to that. Yeah. There is sort of lots of different sort of trauma-informed cares. A lot of them have a lot of the basic principles. Again, some of that may be, to me, when I hear like trauma-informed play therapy, that the question of the autism really comes up for me, because a lot of the idea sort of play therapy with trauma is like healing in the narrative, or healing in the play, where you may be playing with dolls or puppets and you can kind of create healing scenarios and situations to kind of replay and make a different outcome from past things. And that's really hard actually with autism. It's if kids don't have a good imagination, or they struggle to kind of, so that may be that may be one, if there really truly is an autism piece, there may be a different challenge to the therapy part. If that's real, like if they can't do play-based work, or it's really hard to play with the kid because they're licking toys or playing with toys in a more repetitive way that isn't healing. And so while I think all that education piece and the relationship building can really be helpful, I think like understanding her ability and where she is like in that ability to play is really diagnostic too of the autism, and whether or not that becomes a barrier or not to the intervention. That's a big question to me. And again, you can adapt elements of PTIT and you can adapt elements of play therapy to autism, but you have to, as I said, you have to assess the kid to know where to put that thing, and that's such a huge unknown and just a huge label that I'm not sure is accurate. So that may be something to kind of be aware of in that too. And sometimes, and this is, I don't know if how it is down in Charleston with it, but sometimes when you call and you're like, my kid has autism and I want therapy, like it just sort of like split services, like down the middle, like autism's over here and everything else is over here, and people don't often like cross the line there. And so it can, if that diagnosis is wrong or you lead with that, it can really shut down a lot of people willing to kind of do that work, and that may not even be accurate. So I think it's important that we think about that too. I don't know. Do other people see that? Have other people seen that sort of division split with? Yeah.
I feel like that was myself. If you told me you had autism, I'm like, okay, I'm not qualified. But if you came in with mental illness, okay, that's something that I could handle. So I think, yeah, even institutions or program wise, but I think also individual providers might get a little nervous about what they're comfortable working with.
I was wondering too, is mom currently a safe person for her to like be building relationship and attachment with, or with everything that's gone on, is mom still going through some turmoil and things herself?
Mom also has a history of mental illness. So
Mom is, I believe, in therapy for her own issues at the moment, but it's a lot between the two of them. But mom doesn't have anybody else but her mom. So, and that's another issue. We've tried to find resources to help mom at the very least get some respite care. But she applied for IDD waiver and was denied. I'm not sure if she's tried to apply for the CSED waiver yet or not. But mom doesn't get a break, especially now that she's not working. They're just together pretty much all the time.
I wonder if with schools going back in person, it's time to like think about that, just to give mom some respite too. Like, I don't know where their school situation, or if they chose all virtual or if they had some opportunity, but that might be also really important, especially if mom's always not in a good place or it fluctuates. Again, to get more positive interaction, structure, and other sort of experiences, giving mom a break and respite, but also kind of having a normalizing effect, kind of going back with that. Was the school decision about virtual moms, or was that, do you know if there's any opportunity to go back, or where that is?
I think they signed up for virtual for the rest of the year, and I don't think they can switch it back at this point.
They can't say have a doctor's note or a treatment note, and that may be something you might have to like chat with mom about the pros and cons about that, to ask specifically, but they have waived that all over North Central West Virginia when we've had that, and they've been pretty flexible for that. And if a kid has a diagnosis of autism, I would assume they have an IEP and have lots of flexibility. So don't let that be an excuse. I think there's ways around that. But as I said, that's a hard conversation, right? 'Cause your kid's been getting in trouble at school all the time, and like you don't want to take that as a parent. Oh, I'm gonna now have the school call, and the school's gonna complain more. I mean, that can feel like stress. And so I've had parents like choose to homeschool or not take their problematic kids to school because they just think that the school's gonna like harass them or they're gonna hear about it, they don't want to deal with it, and they kind of put it over there, but then they don't give themselves the help and support and the break to kind of do that. And so I think those are always really hard conversations with parents, but if there's some option that could be helpful and she could view it as helpful for the kid, could that be, again, another way to get a little bit more support or a break? I don't know.
I also wonder if getting her, I don't know the guidelines and criteria for this, but getting her established with wraparound services might be helpful. I don't know if there'd be more resources available, because then I would imagine you'd have all your providers in communication with each other. So you may not have that issue of, psychiatry changing all the medications and maybe therapists not agreeing, you're in more contact. Trying to see what I could find about that.
I think those crisis line, I'm not entirely sure, but I think those crisis lines are set to sort of pull into wraparound and like get an assessment. So like, I think they usually do kind of even like the SED waiver starts with sort of an assessment of need. And I think a lot of those things can plug people into wraparound or in-home care or those things from those assessments. And I would certainly think from everything you've told me, that would be an easy mark of level of care. So that may also be helpful. I think the Charleston area has a really good wraparound program. I think they were one of the first in the state to kind of really build that out, and so that might be a really helpful thing. It also could be kind of like that lifeline for mom when it gets too much or she's feeling kind of at her breaking point or super triggered, to just have a number to call right then, right now.
Seems like she might meet criteria: child 0 to 21, mental health diagnosis or IDD, combined with severe or serious behavioral or mental health concerns. So.
Very great suggestions. Sorry. Thank you. Definitely include that as well. Yeah, we'll make sure that Cheryl, you get the suggestions over to you too that were discussed today.
That would be amazing.
And Amanda Newhouse had a reference that she sent me in an email that had a link. It was a Mithra, do you have that? It was a CBT for autism with trauma that had like some.
I do have that. I can try to open it and share my screen, or we can also share it in the recap email, and I can chat it in as well in this session live.
You guys want to see it? It's a pretty picture. I don't know if you would want to see it or if you want her just to attach it, but it was a workbook that it sounded like might really fit.
I can see if I can pull it up here in a moment too. Feel free to continue a discussion. My internet's being kind of crazy today,
No worries. No worries. It was in the email. I don't know if I have it saved over in our file yet. I do apologize, but we'll definitely make sure we get that and links over to everybody as well. Does anybody else have any questions or comments for today's? No. All right, great. Well, the only announcement that I have is our next session will be April the 7th, and Colleen Lillard will be discussing countering misinformation.
I do have it pulled up if you all would like to see that. Thumbs up for yes, no. I don't want to hold you guys longer. We do have 12 minutes. All right, sorry guys, here we go. Can everyone see that okay? So these are the images that Amanda Newhouse had shared with us. And I also chatted in the link to the online PDF, which I can also share my screen and show that page as well. So I believe these were the only two, is that correct? Okay, so there were those two, and let me see if I can share my screen to pull up the actual website.
Cheryl, Amanda also said that that CBT toolbox, so the first picture, has really great links about safety planning.
Okay.
Helpful for you.
Thank you. And this is the link that I chatted in as well. And we'll be sure to include this all in the recap email for you all to have as well.
Thank you so much, Mitra.
Thank you.
All right, everyone. So if there's no other questions, and if you do have any that come up, please do email me and I can share them with Cheryl or anyone from the Hub team. And you get 10 minutes back to your day. So thank you so much for joining us today. And I look forward to seeing you guys again.
And Cheryl, thank you so much. I love doing cases. This was so much fun. We hadn't done a case in a while. I really thank you for that. You did a great job.
Yes, give claps. I'm all about claps.
All of your
Spirit fingers.
But yeah, so like maybe I get really excited about cases, but yeah, please keep bringing them too.
I have another one, so
Okay,
I'll get to work on submitting it.
Send it on over.
You did a wonderful job, and we encourage the rest of you as well to submit cases because it's helpful discussion for everyone to hear and participate in, and it's just so wonderful. So thank you guys.
100%. Thanks, everyone. Have a wonderful day.
Thank you. Bye.